data. Otherwise, the procedure were prepared and organized in advance. For operator, the most often he was a rhythmologist. However, in near 70% of cases, the operator were a hemodynamicist, and this concerned both the private and public sectors. Now for indications, overall we found the classic indications for cardiac pacing, which was mainly represented by AV conduction disorder in 75% of cases, followed by sinus node dysfunction in only 15% of cases, then by bradyarrhythmia in 9% of cases. Now, when we study indications according to gender, we found more complete AV block in women and more bradyarrhythmia in men. And these findings goes against what is reported in the literature. Otherwise, the indications was distributed similarly between men and women, especially for sinus node dysfunction, where the female preponderance was not found in our registry. According to age, we found that complete AV block was more represented in young patients. Otherwise, the indications were similarly distributed regardless of age. Now, for ICDs, curiously, we found only 14% of patients were implanted for secondary prevention, mainly after a documented ventricular arrhythmia. Now for complications. During the study period, 6% of patients experienced any major or minor complications. Most of them occurred early in the first 3 months. And 2.1% of patients developed more than one complication. Now, regarding major complications and according to CID type, we found that infectious complications as well as lead-related reintervention and the procedure-related deaths are more common in case of CRTD, and pocket hematoma requiring drainage is more common in CRTP. And this was consistent with the literature data. Now, for minor complication, we found that phrenic nerve stimulation is more common in case of resynchronization device, which is comprehensive. Now, according to procedure type, we found more pocket hematoma and more wound infection in case of upgrade system. And curiously, we didn't find that infectious complications were more common in case of generator replacement. Infectious complication in our registry were similarly distributed between generator replacement and primary implantation. For minor complications, we found that phrenic nerve stimulation was more common in case of upgrade system. Now, according to gender, and surprisingly, we found that pneumothorax was more common in men compared to women, and we didn't find myocardial perforation, the female predominance of myocardial perforation and pocket hematoma. For minor complications, we didn't find any differences between male and female. Now, in order to individualize predictors of complications within 12 months, we carried out multivariate analysis according to 8 pre-chosen variables, and according to patient-related variables, including gender, age group, body mass index, no association with the occurrence of major complications was found. It is the same was true for minor complications. So the female sex and the underweight didn't appear in our registry as predictors of complications that it has already been reported in other registry. Now, for the procedure-related variables, we found that the risk decreased significantly when the procedure were performed in private sector and in case of generator replacement, and this risk increases significantly when the procedure were done in emergency. We also find a trend to have more complications in case of CRTT. Finally, for minor complication, we found that the risk increases significantly only when the procedure were done by a hemodynamicist. Thank you very much.